world, Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
All right, today's topic is bacterial vaginosis. All right, Doc, as we'll get this information out to our YouTube live stream listeners and also Facebook. Is there news about bacterial vaginosis, often called BV?
Yes, well, you can see why people call it BV because the other bacterial vaginosis is really a mouthful. But forever, we've had the evidence-based medicine, which of course is a new buzzword, has told us that BV is not transmissible. In other words, it is not a sexually transmitted infection. However, the new news, and this is now the official opinion, is that BV is an STI, can be transmitted between men and women.
Okay. All right. The next question is until now, what has been the most common BV treatment for women?
Well, that's right. The treatment has always been, in the last 50 years, for women. And we have ignored men because we thought it didn't do any good to treat men, and we thought that it wasn't a sexually transmitted illness. But there are several options. They have been around for women for 50 years. Metronidazole or Flagyl, 500 milligrams by mouth twice a day for 7 days, and or MetroGel, 0.75 vaginally for 7 days. They recommend against douching or any other uh, things that you would insert into a vagina.
Okay. All right. Next question. Let's see here. How has BV treatment changed?
Well, according to this is a New England Journal of Medicine article, and it's about a new Australian study that was published a couple weeks ago. And now the treatment says that we should treat men with metronidazole by mouth twice a day for 7 days and apply um, MetroGel or clindamycin to you know what. I think we can't say that word on
Right.
YouTube, maybe. And I probably shouldn't have said vagina either, but we'll
I
see.
think no, I think you'll be fine on that. You just can't say that there's that about the COVID vaccine.
I can certainly not say
Yeah.
that. No,
Yeah. No, that's a no-no.
cut my tongue out for that.
Yeah. All right. No, you could say the COVID vaccine, but nothing that's misinformation. We'll see what happens with the YouTube police at one point. Um, let's go to the next question. And Doc, it's just very intriguing some of these topics we're covering now because you have the platform to do that, and that's huge. Is BV thought to be reoccurring?
Well, years ago, again, for the last 50 years, we have offered women, I would say, fairly bad advice. These things have been known to reoccur 2 or 3 times a year. And we've just done the old treatment we talked about above.
Okay. All right. The next question we have is the treatment during pregnancy different?
Well, yes, it's a little different. You still use metronidazole because it's felt to be quite safe for pregnancy. And or clindamycin, they're oral, and they have recommended against vaginal treatments during pregnancy.
Okay. All right. Next question. So we talked about the next one is treatment of a male sexual partner always recommended even in pregnancy?
Yes, that's an easy answer to a kind of complicated question, but yes, you don't want BV in pregnancy.
Can BV interfere with pregnancy?
Absolutely. For many years, we were told and we were supposed to tell our patients that BV it did not cause infertility, that it did not cause miscarriage, and that it did not cause preterm birth. And indeed, we have changed our minds now, and we can recommend that. We know that BV is implicated in infertility, miscarriage, and preterm birth. So there's a really good reason to treat it effectively.
Okay. Next question. Then anyone that wants to comment on any of these questions from the live stream, and definitely on the Royal Doc Allen podcast as well. We want to know these things. Is BV considered to be a sexually transmitted infection?
Well, if you go to the internet, Neil, you're still going to find old information that says it is not an STI. And this has been around for the last 50 years. It'll take a while to get rid of that, I think, on the internet, and probably AI will be talking about it for a long time, saying that it is not. But in my simple mind, I would say if it can be transmitted from one sexual partner to another, that is the definition of a sexually transmitted infection.
Absolutely. All right. Next question. What are the common tests for the diagnosis of BV?
Well, of course, you always want to get a careful history. You want to listen to your patient, and a physical exam are really important. The commonly used diagnostic tools would include a wet mount. In other words, get a sample of the fluid, put it under the microscope, and measure pH. And there's something that we call a whiff test because um, BV has a remarkable odor, whether it's for males or females.
What is the symptom approach for treatment?
Well, symptom approach would be if you can't do any testing. So what you'd be doing is kind of just a shotgun. We call it a shotgun approach. So you'd give the metronidazole, um, and that would treat the BV and trichomonas if it happened to be trichomonas. And you could give then a yeast medication that would treat a yeast infection. So it's basically treating without using any laboratory help.
Can the presence of BV increase the risk of transmission of other STIs?
Well, that is a real big issue, Neil, and it's important for the public because it certainly does increase your risk of having any kind of STI. For example, HIV, gonorrhea, yeast. Chlamydia is the most common STI now today. Mycoplasma, ureaplasma, and PID. And these are all problems with pregnancy and getting pregnant and staying pregnant.
What are some of the signs and symptoms of BV?
Well, there is an unusual discharge, and we call it a fishy odor, irritation of the vulva, and burning on urination. You know, I just want to talk a little bit about one of my pet peeves. They talk about vaginal itching. The vagina can't itch. It doesn't know how to itch. So itching down there has to do with the vulva, and I hope we can say vulva on this
Yes, we can.
without too much trouble. Just can't say the F word too many times.
You mean fun?
Anyway, no, we can't have fun, that's for sure. Um, we can't also think too much. Okay. Anyway, it has to do with the pH of the vagina, and it has to do with the bacteria that are there, that are the harmful bacteria. There are ordinarily healthy bacteria living there, but BB is a change of population.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil, very
All right.
much.
All right. That was the World Doc Allen podcast, guys. Take care.